Hello everyone, my name is Pankaj. I am the Assistant Professor in Department of Pharmacy, School of Health Science, Sushant University. So today we will discuss about the pharmacology of the drugs that is used in the treatment of asthma. So when we will starting about that topic, so we have to discuss about what is the basic introduction about the asthma, then basic pathophysiology that is able to cause the asthma in our body, and the drug that will be used in the treatment of asthma. So when we are discuss about the basic introductions of the asthma, so asthma is a chronic inflammatory disorders of the bronchial airways that result in the airways obstructions in response to the external stimuli. So here are the different types of the external stimuli that will able to cause the bronchial constrictions. And with the help of that type of the bronchial constrictions, we are not be able to breathe properly. And this is the any type of the stimuli that will able to cause the bronchial constrictions, including the cold air and tobacco and smoke also. So these are the basic stimuli that will able to cause the asthma in any patient's body also. So here are the different types of the characteristics of the airways in asthmatic patients. So it will basically include the airways of the hyperactivity, inflammations and bronchial spasm also. So when we are talking about the here airway hyperactivity, so it is the abnormal sensitivity of the airways to any external stimuli. So when any external types of the stimuli will able to enter in our body, so they will cause the hyperactivity in our body also. So it will able to cause the different types of the symptoms of the asthma also. Second one, when we are discussing about the inflammation, so it will able to increase the edema, swelling and thickness of the mucus production. So three of them will able to cause the inflammations in our body, and it will also lead to the different types of the symptoms of the asthma. And third one, as we have discussed, the bronchospasm. So it is the constrictions of the bronchial smooth muscles, and constrictions of the bronchial smooth muscle is also lead to the asthma. So these are the basic symptoms that we will able to see in any particular type of the asthmatic patients also. Now, when we are talking about the basic pathophysiology of the asthma, so we will able to define that the airway size of the bronchioles will be constant when we are talking about the asthma. So when you will able to measure the normal airway size of the normal patients as compared to asthmatic patients, so it will able to decrease the size of the bronchioles into the asthmatic patients also. Now here are the different types of the factors that will relate to the generate the pathogenesis of the asthma. So basically smoking is the one of the factor that will related to cause the asthma. So when any particular type of the human being will able to inhale the smoking particles, so it will directly going to the epithelial cells and macrophages. By acting on the that types of the epithelial cell, it will either able to increase the fibroblast, Th1 cells and TCT cells. So when they are acting on the fibroblast, so they will cause the fibrosis, which will basically known as the smaller the size of the airways. And second one, Th1 cells and TC1 cells, they will the elevators of the walls of the districtions that will cause the inflammations in our body also. And then we are talking about the second one, which will be macrophages. So they will directly act on the neutrophils and monophils. So that neutrophils will able to cause the proteases that will increase the mucus productions and hypersecretion of the mucus in our body. So this is the basic category or basic types of the external stimulus particles that will able to cause the asthma in our body. So there are the different types of the symptoms we will able to seize in any asthmatic patient. So either they will have the acute bronchoconstrictions, shortness of the breathing, chest tightness, rapid respiration and cough. We will able to determine that the cough is the main symptoms of the any asthmatic patients also. Now, when we are talking about the anti-asthmatic drugs, so they will basically divide into two basic categories. First one, which will be known as the bronchodilators. So they are basically known as the quick relief medications. So they are the drug of choice when we are talking about the treatment of the asthma. So they are basically divided into three categories. One is known as the short-acting beta-2 agonist. Second one is known as the anti-muscarinic agents, and third one is known as the xanthine preparations. The second category, when we are discuss about the anti-asthmatic drugs, so it will be known as the anti-inflammatory agents. So it is the prophylactic therapy that will use to reduce the frequency of the attacks of the asthma. They are further divided into 5 categories, including corticosteroids, mast cell stabilizers, leukotriene antagonist, anti-IgE monoclonal antibody, and here long-acting beta-2 agonist also. So these are the two types of the basic categories of the drugs that will use in the treatment of asthma. Now we will discuss about the first one, which will be known as the bronchodilators. So that types of the bronchodilators are the drugs that produce the rapid relief of the bronchoconstrictions. So bronchodilators are including the beta-2 adenoreceptors agonist and antimuscarinic agents and your xanthine preparations also. Now, when we are talking about the sympathogenic agents, which will be known as the beta-2 receptors agonists, so when we are discuss about the basic mechanism of action of these drugs, so they are directly stimulate the beta-2 stimulations. By acting on the beta-2 receptors, they will be able to stimulate the adenyl cyclase, and it will increase the adenyl cyclase CAMP, and they will able to cause the bronchodilators. Then bronchodilations able to increase the mucus clearance by the increasing the ciliary activity, and they will also able to stabilize the mast cell membrane also. Now, when we are to classify these types of the bronchodilators, so they are divided into two basic categories. First one, non-selective beta agonist, and second one is selective beta-2 agonist. So we are basically prefer the selective beta-2 agonist as compared to non-selective beta agonist. So when we are talking about the selective beta-2 agonists, so they are mainly given by the inhalation routes. So they are given by the meter dose containers. So accurate amount of the dose will given by that types of the formulations with the help of that types of the inhalation meters. So it comes under the category of inhalations and nebulizer routes also. So selective beta-2 agonist is basically divided into two categories, including short-acting beta-2 agonist and our long-acting beta-2 agonist. So the short-acting beta-2 agonist is basically contain salbutamol, and long-acting beta-2 agonist is contain salmeterol. So here are some of the examples or some of the market formulations that comes under the category of nebulizers and inhalers also. So these types of the nebulizers are given by the nebulizing forms, and inhalers is given the accurate amount of the dose to any particular type of the patient that is suffering from the asthma. Second one, when we are talking about the bronchodilators, that is contain the muscarinic agonist. So it is basically contain two drugs, ipratropium and our tiotropium. So they are basically act by the blocking the muscarinic receptors and given by the aerosolar inhalational routes also. So they are produce the systemic side effects also, and ipratropium and tiotropium have the difference between the durations of the actions when we are talking about the bronchodilators. And ipratropium has the short durations of the actions according to about the 3 to 5 hours, and tiotropium have the long durations of the actions about 24 hours also. So when we are talking about the basic pharmacokinetics of that types of the drugs, so they are have the short durations of the actions and long durations of the action according to their stability. They are basically metabolizing the body and distributed all over the parts of the body, and they are mainly excreted out from the faces and different types of the you can say that the waste materials also. When we are talking about the pharmacodynamics, so they inhibit the bronchoconstrictions and mucus secretions. They are less effective than beta-2 agonists, and they are not produce any types of the anti-inflammatory actions in our body also. So they are mainly used in the treatment of COPD, and they are also used in the treatment of several types of the asthma with combinations with the beta-2 agonist or corticosteroids also. Third one, we have the methylxanthines, that is also the drugs which will become under the category of the bronchodilators. So these are basically contain theophylline and our aminophylline. So they are phosphodiesterase inhibitors. They basically increase the cyclic aminophosphate and produce the bronchodilation effects in our body. So they are adenosine receptors agonists, and they are not very slightly used in the treatment of asthma also. They increase the diaphragmatic constrictions and stabilize the mast cells in our body also. Here we are able to see that is the basic mechanism of actions of our phosphodiesterase inhibitors. So they are ATP is directly converted into CAMP with the help of adenyl cyclase, and further it will be converted into the CRE5-AMP with the help of phosphodiesterase, and theophylline will act on that types of the phosphodiesterase, and they will able to inhibit their actions. So our bronchodilators effects will be provided by this types of the medicines. Okay, so second class, when we discuss about the that it is used in the treatment of asthma, are known as the anti-inflammatory reactions. So these are not only known as the they are not only provide the bronchodilator effects, they have the anti-inflammatory effects in our body also. So when we discuss about the different symptoms of the asthma, so asthma is not only related to the size of the bronchioles. There are the different types of the mediators, including the leukotrienes, mast cell, and prostaglandins that is released in our body, and it will produce the inflammations to all the area of our lungs also. So here are the drugs that will use in the treatment of that types of the symptoms, which will be known as the anti-inflammatory agent. So they are basically contain glucocorticoids, leukotriene antagonists, mast cell stabilizers, and anti-IgE monoclonal antibody also. So the basic mechanism of actions of that types of the anti-inflammatory agents is that they will able to decrease the bronchial hyperactivity. They will reduce the inflammations of the airways. They will reduce the spasm of the airways also. So these are the three main mechanisms by which anti-inflammatory agents produce their effects in our body. Now, when we discuss about the first class of that types of the drugs, which will be known as the glucocorticoids, so they are basically divided into two categories: systemic and inhalational routes, or they can be given by the systemic or inhalation routes also. So systemic glucocorticoids is basically contain hydrocortisone and prednisolone. Inhalational glucocorticoids is basically contain beclomethasone and budesonide. So anti-inflammatory actions of that types of the glucocorticoids is produced because they are inhibit the phospholipase A2 receptors in our body, and they will able to decrease the prostaglandins and leukotrienes. They are also able to decrease the number of inflammatory cells that is present in our bodies or in the airways also. Then they will also able to produce the mast cell stabilizing effect, which will decrease the histamine release. And by this types of the action, they will also reduce the bronchial edema and inhibit the antigen antibody reactions. So these are the basic mechanism of action of the glucocorticoids by which they will able to treat the different types of the mediators that will able to increase the hypersensitivity of the in the any particular type of the patient that is suffering from the asthma. Next anti-inflammatory agent when we are used in the treatment of asthma is our mast cell stabilizing agent. So these are basically contain the drugs that is known as this sodium chromoglycate and nadochromyl. So nadochromyl is not commonly used in the treatment of asthma, so we are only use the sodium chromoglycate. So they are basically act by the stabilizing of the mast cell membrane in our body, and it is basically given by the inhalational route. They have the poor oral absorptions. About the 10% of the drugs is absorbed from our body when we are given by the oral route. So that's why we have to given this type of the medications by the inhalation routes. So when we are basically talking about the pharmacodynamic of mast cell stabilizers, so they are not bronchodilators and not produce any particular type of the actions according to bronchodilators. So they are not effective in the acute attack of the asthma also. So we are not supposed to use this type of the medications in the acute attack of the asthma. They are the prophylactic anti-inflammatory drugs that is reduce the bronchial hyperactivity, and by this types of the actions they are effective in the antigens and different types of the irritants that will able to cause the inflammations in the size of our bronchioles also. So there are some of the side effects that is caused by the bronchodilators as compared to the anti-inflammatory agents. So anti-inflammatory agents also produce different types of the side effects, including they have the bitter taste, and minor upper respiratory tract irritations is also caused by this types of the medications, which will include the burning sensations and nasal congestions also. The next drug we will use as an anti-inflammatory agent that is used in the treatment of asthma is our leukotriene antagonist. So leukotriene antagonist is basically used in the treatment of asthma because they are produce the bronchoconstrictions. They are inhibit the bronchoconstrictions effect of acetyl leukotrienes, which will include the CD4, C8 and E4 also. So they are leukotrienes are they synthesized by inflammatory cells found in the airways, basically contain the eosinophils, macrophages and mast cell also. So they are produced by the actions of 5-lipoxygenase and arachidonic acids. So when we are talking about the basic mechanism of actions and the drugs that is comes under the category of leukotriene antagonists. So they are basically contain montelukast and our japirokast. So these are the drugs which will rapidly or broadly used in the treatment of asthma. When we are talking about the basic mechanism of action of this type of the medicines, so montelukast is act on the CYST1 receptors, and they will act on the leukotrienes LTC4 and our LTD4. So they will given by the only oral route, and they are also produce the bronchodilator effects and anti-inflammatory effect. So these are the one of the drug that have the both type of the actions as compared to the bronchodilators or anti-inflammatory drugs, because they will able to produce the both of the actions in our body also. So they are less effective when we are given with the this type of the medications in combination with corticosteroids. So this is the drugs which will not be given in combined with different types of the corticosteroids. So next or last one, when we are discuss about the anti-IgE monoclonal antibody, so it is basically contain the omalizumab. So this is a monoclonal antibody directed against the human IgE, and it is given by the injections or our subcutaneous route. So they are directly going to our systemic circulations and produce their effects in our body also. So they will able to prevent the IgE binding with its receptor on the mast cells and basophils, and they will able to decrease the release of different types of the allergic mediators also. So they are expensive and not used of the first line therapy in the treatment of asthma. Used for the treatment of moderate to severe types of the allergic that is produced by the asthma are not respond, and they are basically respond to the high dose of the asthma. So basically we can say that the when corticosteroids is fail and not to be able to produce their effect, so we have to use the monoclonal antibody, as they are the drugs which we are the basic they are the expensive in the nature, so we are not commonly use these types of the medications also. Okay, so these are the drugs including our bronchodilators and anti-inflammatory agents that we have to use in the treatment of asthma. So I hope you understand about the basic definitions of the asthma, what is the basic pathophysiology of the asthma, and different types of the medication that is used in the treatment of asthma also. So thank you all for carefully listening the lectures, and I hope you will get the basic knowledge about the asthma.